Well, the easy thing to do is to look at the number of people that we've actually looked after. But then once we start doing that, it gets more difficult. So if we physically looked at the number of people who'd been admitted to beds in either St Julia's or Mount Edgecombe, that runs into thousands of patients in the 40 years since Mount Edgecombe were working, and the 21 years in the new building in St Julia's, but the years plus since the mid-1980s that St Julia's has been functioning. And when I went to an event at Clarence 3 or 4 years ago to celebrate 35 years of St Julia's, when I calculated it, we'd looked after thousands of patients just in St Julia's. That's thousands of patients who've had their distress relieved, their pain sorted, their vomiting controlled. But what we've also done is make more difference to all the families around those patients, because it means that they may not be so frightened of somebody dying in future. They may know what a good death looks like, so then they can advocate for that to happen for their own families, and that's important. But as well as the patients in the beds, we've got all the patients that we see directly in oncology clinics, in pain clinics, in our neighbourhood hubs, in domiciliary visits, in any transaction where any of our really skilled staff go out and see people outside the hospices, and we can count those numbers. But what we can't count on top of that is the influence that the difference we make to people when we see them has in terms of everybody. That's immeasurable. So the fact that so many people believe in what we do, are happy to come back and volunteer, for example, in Cornwall Hospice Care or work in Cornwall Hospice Care, means that they've had a positive experience, and all the people who support us by donating goods, by donating money in their wills, by donating time to collect, deliver, do whatever, all of those have been touched and influenced by what we do. So it's incalculable, the difference we've made. Hard things that we do that can be measured, we've got statistics for, but there are things that happen within the hospice that are immeasurable and incalculable, and we get lots of letters of thank you, and they all try and express what it is that they're thankful for, and I don't think anything does it better than this letter from 2016, which I'd just like to read, if that's all right. When my father arrives in the hospice, there is a flurry of activity. Drug charts are checked, vital signs are tested. We all know he has come here to die, but still the idea that something might be fixed, at least temporarily, and the young doctor and nurses on duty that evening have an air of sorting things out. It is a relief to get here. They know what to do. The flat has become claustrophobic, smelly, and an unmanageable place for my mother to care for Dad. The next day, you slide into the room like an elegant cat, without an entourage of junior doctors, a computer on wheels, or a stethoscope slung round your neck. You lean over my sleeping father and take him in without saying anything, and then turn to my mother with a smile that is at once kind and serious. You take us to a side room and tell us that he is nearly finished with his body now, that it is normal and natural, and that there is nothing to be done except to keep him comfortable. You say it clearly and calmly, making eye contact with my mother. It is a beautiful day, and you suggest we take a walk and look at the sky, the daffodils, and the trees beginning to bud. He will be with you in these things, you say, entirely without sentimentality. It is time to let him go. For the first time in the entire period of my father's cancer, my mother cries. Woman to woman, you look at her, and she feels your genuine solidarity. It is a turning point, and from then on, my mother prepares to cut free from her husband of more than 55 years. Over the next days, when on duty, you appear quietly in the room with an aura of respect for the sacred space that we have created, with flowers, cards, and drawings by grandchildren. You never talk loudly to my father as if he is deaf or stupid. You also never adopt the drippy, concerned tone often used by professionals with the ill or the grieving. Your gaze is clear and direct, as is the information you give us. Dad is taking his time. He has things to say, and his body is not quite ready to close down. This is not a medical condition we can treat or something I can help with, drugs or charts, you say, as I pack away my violin after playing the Scottish folk tunes of Dad's childhood to him. This, she gestures to my son sitting on the bed, the guitar lying on the chair, Mum holding Dad's hand. This is all that's important now. There is nothing to do but wait, and I see from your experience and wisdom that you know how hard this is, this endless waiting, which is pregnant with ambivalence. You have seen this many times before. Thank you for what Cicely Saunders, the founder of the modern palliative care movement, called the depth of time that you have given us. Perhaps you spent no more minutes with my dad than any of the other professionals. Perhaps you even spent less time, as you didn't bother much with symptoms or drugs and interventions that we could all see were pointless. But you met my dying father, my mother and me with honesty, dignity and sincerity, and this is what we will remember and treasure.